So what are the tight pelvic floor symptoms? How can you feel it? And what can you do about it? Today, I will cover briefly main symptoms of the tight pelvic floor, and I will show you one exercise that you can literally do every night while watching your Netflix series. That will help you to release your pelvic floor tension, release pain, and improve your overall health, because our pelvic floor health is the basis of our overall health. So the symptoms that you can have may be a pain at the pelvis region. That can be a pain around your tailbone zone, a lower back pain that can radiate to the hips, to the perineum. It can be a painful intercourse, difficulties inserting tampons if you use it, or during your gynecological exam. Other symptoms may include constipation, difficulty urinating, difficulty starting your urine flow, and difficulty emptying your bladder fully. You may also have some aches and pains that are moving at your pelvis region, and you cannot understand what they are, but you may have some cramps, you may have some pain in the lower abdomen. These are all possible symptoms of a tight pelvic floor. The reasons for tight pelvic floor may vary. That may be a trauma, a history of sexual abuse, some physical trauma at the region. It can be overtraining, women who lift heavy and don't pay enough attention to stretching and relaxation of the inner thigh, glutes, and pelvic floor muscles. It can be history of various infections. Pelvic floor can be contracted as a consequence of some psychological problems, some stress, some traumas. It acts like our neck that react to the tension and stressors of our life. One of the best things that we can do to relax our pelvic floor muscles is a regular exercise. These exercises are not difficult. And today I'll show you one exercise that will take you only 5 minutes, and you don't need to move, you need to relax. One thing you need to do is to find your perfect position, and that's why I want to explain it in details. Watch until the end. It will take you a few minutes, but you will love this posture, and I promise that you will feel positive effect immediately. For this posture, I need 2 yoga blocks. You can use some really thick book that needs to be more or less of this size. So we are putting one of the blocks under our butt. This is a butterfly posture, Baddha Konasana is it called in yoga. And you need to sit at about 10 centimeters off the wall. And I put the second yoga block at the lumbar spine. And then I need to correct my posture. I need to put my heels closer to my butt. And the most important thing here is to find my neutral pelvis. To do so, I take my glutes and I pull them back. I pull back my glutes, and now I need to move my block a little bit because I want to find myself sitting on my sitting bones. I need to feel it definitely well, and with the help of the other block that I put here at the lumbar spine, I need to find the position where I can maintain the neutral spine, the neutral pelvis, with my personal feeling of arching a little bit at the lumbar spine. If I'm not having this feeling, I'm taking my glutes and I'm pulling them back a little bit more. And maybe I move my block a little bit more towards the wall. And yes, now I have this sensation. This is a feeling when I'm, without any effort, feel like I'm having a little bit lumbar curve. When I'm feeling my sitting bones and my pelvis is neutral position. This position also helps me to maintain my back straight and my chest open without any effort. So that is the position that we need to find. Also, you need to be symmetrical, so repeat this movement as much as you need to finally feel the sensation of zero effort, lumbar spine curve, sitting on your sitting bones with your chest open. And now you can relax. This is how we can stay from 2 to 5 minutes. And the only thing that can stop you from being here for 5 minutes is your hip muscles. If you're not flexible enough, after 2 or 3 minutes you will feel, maybe even earlier, after 1 or 2 minutes you may feel a deep stretch here that can become annoying. If you have this problem, you can put your legs here, maintain the position because it took us so long to find it. Don't lose it. Stay here as long as you need and then return. While staying here, keep on breathing slowly. Keep on breathing with your belly relaxed and try to connect with your pelvic floor. There's nothing special that we need to do. Just inhaling, try to feel or imagine at the beginning you becoming larger. And then we exhale, it closes softly. So inhale with the belly relaxed, with our pelvic floor that reacts and release. And when we exhale, it closes like a flower. Even if it's difficult now to feel the exact sensation, physical sensations at your pelvic floor muscles, you need to go on using your imagination. This sensation will arrive, and even if you're just staying here physically without involving your imagination for some reason or the other, maybe there are your kids, your family, you cannot concentrate, but you can stay here. Just being physically here will help you. When you add your breathing and your concentration, the position will become double effective. I'm coaching women over 40 to stay fit, healthy and living their best life. Put a like on this video, leave a comment and subscribe to my channel.